very concerning information about the Hispanics in specifically in Indianapolis. So Eskenazi Hospital has seen an increased number of Latinos or Hispanics arriving to the hospital. Tell us a little bit about this.
Yeah, just like we're seeing all around the country in major cities, we're seeing a large number of Hispanic Latino patients coming in to the hospital with the disease requiring either extra oxygen or in some cases intensive care support for this disease.
Okay, so the number of Latinos arriving to the Eskenazi Hospital are in serious condition.
That's right. I'm an intensive care doctor, so I'm seeing patients in the ICU every day and definitely seeing a large number of Hispanic Latino patients coming in. Have even seen some cases where members of the same family have become ill and groups of families or members are coming in together.
Compared with other ethnicities, do you consider the Hispanic patients to be higher than others?
I do. I think we're seeing exactly what's been seen in some of the other big cities. And there are a variety of different reasons that we speculate why that might be. We know that there's a lot of undiagnosed and untreated diabetes, hypertension, in some cases obesity among these communities. Maybe because there's not as much access to primary care before people get sick. We know that diabetes, for example, is a big risk factor for getting severe disease with COVID-19. I also know from talking to some of my patients that it's hard to socially distance, particularly if you're working in a job that requires you to be in and out the community and around people. Finally, not everybody, as you know, Luis, can stock up with groceries for 2 or 3 weeks. And so I believe that some of those social determinants of health, as we call it, may be impacting certain communities, leading to higher rates of infection and severe illness.
That is very concerning. What will be your clear and straight message to the Hispanics here in Indianapolis, doctor?
I want them to know, first of all, that here at Eskenazi Health, we're going to care for them. We pride ourselves on taking care of everybody in our community, and the care you'd receive here in the hospital would be no different than anybody else. I want our community to know, particularly our Hispanic Latino members, that you are at some increased risk, particularly if you have diseases that aren't being treated, such as diabetes. It's important, and this is the main message, not to get complacent. And what I mean by that is continue to socially distance as best you can, continue hand washing and staying away from people that you know have the disease or that are sick, and continue to take every measure to protect yourself, because I don't want you to end up in my ICU. It's really important to me that we as a community all together take these measures to stop the spread of the virus.
Excellent, excellent message, because this is important, and we need to understand that this is serious,
Mhm.
and this is not a game, and we have to take it as serious as it is. And eh, you know that the number of patients arriving to hospitals in New York have a decrease in the last few days,
Mhm.
and the governor of New York says that they've flattening the curve.
Mhm.
Is that what is happening here? Have you noticed the decrease in the number of patients arriving to Eskenazi Hospital?
Yes, we are seeing the same trend that's being seen in many cities around the country, which is the number of patients coming in, especially those with severe disease, appears to be flattening. But it's important for everybody to understand that we're still running 3 and 4 times our number of ventilators. There's still many, many more patients than normal in intensive care fighting COVID-19. So while the curve is flattening, that doesn't necessarily mean that this is going to all get better quickly. It just means that it's going to be spread out over a longer duration. And so the measures that are in place, the social distancing, remain extremely important. As more and more testing comes on board, I'm hopeful that we'll be able to open things back up and let people get back to doing what they know and love to do.
Do you consider, because this morning the Indiana Department of Health published different, a little more information, biographical information, I would say. But also what it calls my attention is that for third consecutive days, the number of deaths have decreased. Do you think that that is a good indicative of that we are flattening the curve also?
Yeah, that's one of the measures we're following. Remember that when people get severely ill with this disease, they tend to be in hospitals and often on life support for a week or maybe more fighting this. So while we are seeing some deaths going down, we still have many, many patients that are fighting every day for their life. So it remains really important for people to understand that this is not over. We're just finally getting into a bit better place, but we need to keep working hard to keep our community safe.
In terms of vaccine or medication, do you have any knowledge of anything that is, I mean, we know that 100 and something countries are working on looking for a vaccine right now, but are you guys providing some type of medication to your patients that may help at least to ease the symptoms?
We are, and we're trying to do that in combination with the School of Medicine to do this in clinical trials so that we can understand if the medicine really does work. All medicines, as you know, have side effects. And one of my big worries on these new medicines and using them for a new disease is what if the cure, what if the medicine causes more trouble or more problems than the disease itself? The only way we can discover that is if we study it with clinical trials. So we've been using the medicines that we've seen published on in medical journals, and every day new information comes out that we're staying on top of as to what medicines are most effective and when are they most effective. So it may very well be that some medicines work earlier in the disease and other medicines are more effective later in the disease. So we're discovering more and more each day and trying to stay on top of it as best we can.
Okay. And finally, doctor, do you think that after the stay-at-home order is lifted, do you think everything is going to go back to normal?
I'm not sure on that because I believe there are many people in our communities who have not yet been exposed to the virus. So what will be so important is that as we open things back up, we know who is, let's say, for example, immune. We can quickly identify when somebody is sick with lots of testing and isolate them right away to prevent further spread. So as you're seeing in the news locally and around the nation and other nations, we need more testing to come on board so that we can accurately diagnose the virus in a quick fashion, trace people who are infected and isolate them, and identify people who have been infected but are now immune so they can get on with doing what they need to do.
All right. Well, thank you very much, Dr. Carlos, for talking to us in the show. And wish you well. And please stay safe because we
Thank
need
you.
you.
God bless you
We
all.
need you.
Thank you.
Thank you.